Virginia. This is Virginia This Morning.
This segment is sponsored by Stony Point Surgery Center.
The survival rate for patients with colorectal cancer caught early is close to 90% for early detection. The main challenge is getting comfortable with the idea of a colonoscopy. Dr. Andrew Vorenberg with colon and rectal specialists and Julie Bragg, Community Outreach Director with Stony Point Surgery Center, join us this morning. Good morning, you two.
Good morning.
Good morning.
It's an important month. It causes us to pause and say, all right, I need to be thinking about this. But Doctor, you come across plenty of people who are uncomfortable thinking about this.
Right. Throughout the year, we have patients that come through our office continually talking about, and we're always talking to them about the risk of colon cancer, and March is a nice time to be able to focus more specifically with our patients or with the community in general about the risk of colon cancer and making sure that people are getting screened appropriately.
Now, Julie, as Community Outreach Director with Stony Point Surgery Center, you are in the community, you are letting people know that it is the time of month to be thinking about it.
Right, and this is one of those things, as there are a lot of things like this in the medical community that we just don't want to talk about, we don't want to think about, we don't really want to do, but we really need to do because it's a screening that can save lives. And talk a little bit more about how effective the screening is and how we truly can save lives.
Well, there are several different ways to screen for colon cancers. You can do CT scans, you can do barium enemas, you can do fecal tests. But really the most effective way to screen and to prevent polyps from coming back is to do a colonoscopy. And any of the other screening modalities, if you have a positive test, meaning you find a polyp or a tumor, then you need a colonoscopy. So I counsel my patients that unless they're otherwise contraindicated for a screening colonoscopy, that's what I would recommend for them. Because it's both therapeutic and diagnostic and therapeutic. You can take the polyp out at the same time.
And it's not the, as you're mentioning, it's not the colonoscopies of yore. I mean, it's a different day for the procedure. It's kinder, so to speak.
Kinder.
Right.
Please explain.
Okay, so we have we have a protocol where we have two surgery centers where we do colonoscopies. We also have anesthesiologists that put you to sleep. So that is part of the kinder approach. You don't feel or remember a thing. The anesthesiologist is taking care of you the entire time, so my job is to do a colonoscopy without having to worry about the safety of the patient. That's the anesthesiologist's job. I can concentrate on the colonoscopy. Plus the prep that we offer is significantly more kind. We offer the pill prep to healthy patients. We also offer a more concentrated prep, or half the volume that other folks offer, so that our patients don't have to drink the dreaded gallon of Go Lightly.
And it's a quick adjustment when you're coming back, too, in the procedure that you're using.
Absolutely. The type of anesthesia we use, you fall asleep very quickly and you wake up very quickly and your mind is clear. So you can concentrate on what I'm actually saying to you. There are a lot of patients who go to other facilities and they say they don't remember a thing. They don't remember where they were. They don't remember what the results of their procedure were because they were so zonked by the anesthesia.
And that could be particularly discomforting, just to be out of it like that. So it's nice to be able to come back.
Absolutely. Patients wake up and they say, are we done? Or when are we going to start?
Yeah, exactly.
When are we going to start the procedure?
So I'm thinking if people are watching, or me and Jess, let's say, it's not quite time for us to be recommended to do this, but I bet somebody in our life needs to do this. A mom, a dad, an uncle, an aunt, a cousin. What do we tell them? What do you tell people?
I tell patients that the best thing they can do to make sure that they live a long, healthy life is to make sure they get a colonoscopy. The facts are that 1 in 19 people will come down with colon cancer in their lifetime. The earlier you detect the colon cancer, the more likely you are to survive it. You catch it before it becomes a colon cancer, then you're obviously going to survive that. But if you catch it when it's a stage 1 or so, you're going to have a greater than 90% chance of surviving that cancer, and you will also won't have to have chemotherapy or radiation therapy, which is...
Yeah, taking the bull by the horns and really just getting in there and getting this. I mean, if you want to think of it as getting it over with, but that's the step to take, isn't it?
And a lot of patients come into my office, younger folks, in their 30s and 40s who say they don't know what their parents have because they haven't ever had a colonoscopy. And their parents are in their 50s or 60s. The most common time to be diagnosed with a colon cancer is in the early 60s. That's why we recommend getting screened 10 years before that so that you can catch the polyp before it becomes cancer.
Yep.
You know, and I asked him when I met him,
What's that?
why do you do what you do? And you said you get that question all the
I get
time,
that
but he has a
question.
great answer.
I love being able to take out a polyp and say that person may have had colon cancer in 10 years. And therefore, I think we may have extended their life.
And now they
That's
don't.
fantastic.
Yeah.
Thank you for the work that you're doing. And thanks for bringing it to our awareness, too, because it is important to take time and take action.
And
Dr.
it's
Andrew
not
Vorenberg.
as bad as we
It's-
think.
No, it's not. It really isn't. Learn more about, thank you, you two, appreciate it.
Thank you very
Learn
much.
more about the kinder colonoscopy that Dr. Andrew Vorenberg has been speaking of. You can connect with colon and rectal specialists by calling 249-2465 or visit crspecialists.com. And right now,